Climate change is no longer a distant threat. It's here and it's changing our world, affecting every aspect of our lives, often in ways we are only beginning to understand. The air we breathe, the water we drink, and the food we eat are all being impacted. One of the most alarming aspects of this change is its impact on human health. Rising temperatures, extreme weather events, and environmental degradation are creating a perfect storm, leading to a surge in heat-related illnesses, respiratory problems, and the spread of infectious diseases. These health issues are becoming more frequent and severe. The statistics are concerning, but beyond the numbers lie individual stories of suffering and loss, painting a stark picture of the human cost of a warming planet. Families are being displaced, livelihoods are being lost, and communities are being torn apart. We are facing a global health crisis, and its roots lie firmly in our changing climate. The time to act is now, before the unseen hand of climate change tightens its grip even further. As temperatures rise globally, driven by climate change and human activities, heat waves are becoming more frequent, more intense, and longer lasting. Our bodies are not designed to cope with prolonged exposure to extreme heat, and the consequences can be dire, affecting our overall health and well-being. Heatstroke, a life-threatening condition, occurs when the body's temperature regulation system fails, leading to severe organ damage and even death if not treated promptly. The elderly, children, and those with pre-existing health conditions are particularly vulnerable to heat stress, making them more susceptible to its harmful effects. But the impact of heat goes beyond these acute events, affecting long-term health and quality of life. Studies have shown a strong correlation between rising temperatures and increased hospitalizations for cardiovascular and respiratory illnesses, highlighting the serious health risks. The strain of extreme heat on our bodies is undeniable and often underestimated, posing a significant challenge to public health. Air pollution and climate change are a dangerous duo, conspiring to worsen respiratory health worldwide. Rising temperatures exacerbate ground-level ozone formation, a key component of smog, which can trigger asthma attacks and other respiratory problems. Wildfires, fueled by hotter and drier conditions, release massive amounts of smoke and particulate matter into the atmosphere, further compromising air quality and posing serious risks to respiratory health. The increasing frequency and intensity of these events mean more people are exposed to hazardous air, leading to a surge in respiratory illnesses, particularly among children and the elderly. Section 4. The unwelcome guests, infectious diseases. Climate change is dramatically altering the landscape of infectious diseases, creating increasingly favorable conditions for their spread and emergence. Warmer temperatures and changes in precipitation patterns can significantly expand the geographic range of disease-carrying insects like mosquitoes, thereby increasing the risk of vector-borne illnesses such as dengue fever, Zika virus, and malaria. Rising sea levels and extreme weather events can also contaminate water sources, leading to severe outbreaks of waterborne diseases like cholera and typhoid fever. The intricate and complex link between climate change and infectious diseases poses a significant threat to global health, potentially leading to widespread outbreaks and epidemics that are increasingly difficult to control and manage. Addressing this challenge requires a coordinated global health response and innovative strategies to mitigate the impact. Section 5. A shared responsibility, the urgency of global action. The evidence is clear. Climate change is not just an environmental issue, it's a profound public health crisis. The impacts are already being felt worldwide, and without urgent action, the situation will only worsen. Addressing this crisis requires a global, multi-sectoral approach. We need to drastically reduce greenhouse gas emissions, invest in renewable energy sources, and transition to a more sustainable way of life. Simultaneously, we must strengthen public health systems, improve disease surveillance and early warning systems, and raise awareness about the health risks of climate change. Section 6. Our health, our future. The future of our health is inextricably linked to the fate of our planet. We can no longer afford to view climate change as a distant threat. It's a clear and present danger to human health, demanding immediate and decisive action. By addressing climate change, we are not just protecting the environment, we are safeguarding our health, well-being, and the future of generations to come. The time for complacency is over. The time for action is now. Our health and the health of our planet depends on it.